Let me tell you, I'm out here from a very far away place. All for a chance to be a star. Nowhere seems to be too far. Los Angeles.
Hi, my name is HBS and I will be the narrator of this video. What could possibly have happened to Jon Snow? So we're going to take a further look into his history, take him to a psychiatrist to look into his mental health and see what's going on there, and then take him to a medical technologist to do blood testing, to see if he's abusing drugs or what is happening, and then to a pharmacist, which will hopefully prescribe the medicine needed to treat Jon Snow. Jon Snow is your typical middle-aged Czechoslovakian male 2'3" with dark brown hair and brown eyes. He has always been very healthy and very studious. Growing up, he experienced physical, emotional, and sexual abuse. He lacked the nurturing attention needed as a child and was left to take care of his siblings on his own. Working 2 jobs, attempting to keep up in school, and becoming a Division I badminton player actually improved his skills in juggling responsibilities. But through his busy schedule, Jon never received the psychiatric help needed after growing up in an abusive household. Jon Snow presented to the emergency ward, complaining of restlessness, depression, and inability to concentrate. He was disheveled and agitated with blunted incongruence affect, thought disorder of auditory hallucinations. He claimed to be unable to remember details of his childhood and that both of his parents were alcoholics. He had done well in school until age 16 when he began abusing drugs and alcohol. He worked steadily for several years until he was limited by his substance abuse and frequent hospitalizations and was then supported by a disability pension. He had several short-lived, unstable relationships with women. At 17, he accidentally cut himself and noticed no pain and began cutting himself repeatedly. He was hospitalized in his early 20s and was treated with phenothiazines for about 4 years. He was subsequently hospitalized because of the suicide attempts and behaving strangely. He met DSM-3R criteria for schizophrenia, a differential diagnosis of a personality disorder with schizophreniform episodes, and also considered. A second psychiatric opinion supported this assessment. The patient was convinced that he had MPD, multiple personality disorder. This was first suggested to him by a friend because of his intermittently childish manner, mood swings, and poor recall of childhood events. He read several books on MPD and demanded hypnosis and intensive psychotherapy. After several consultations, he was diagnosed as having MPD by one therapist with a special interest MPD and probable dissociative disorder by a second therapist. The diagnosis of MPD appeared to be based on the patient's psychopathology. Then there is the medical technologist. They analyze samples of blood tissue and body fluids to determine the chemical content, cell count, and drug levels or blood types. They may also search for specific microorganisms like bacteria or parasites, preparing these samples for examination using automatic equipment and specialized instrumentation, performing numerous complicated tests, and simultaneously and accurately interpreting the results are all part of the medical technologist's job. They did so in this by finding alcohol and drug abuse in Jon Snow's blood. A psychiatrist who prescribed, direct, or administer psychotherapeutic treatments or medications to treat mental, emotional, or behavioral disorder. They analyze and evaluate patient data sheet or test findings to diagnose nature or extent of mental. Hypnosis is sometimes used to help people with DID learn more about their personality states in hopes of their gaining better control of those states. Although medications can be helpful in managing emotional symptoms that sometimes occur with DID, caution is exercised when prescribed in order to avoid making the individual feel re-traumatized by being controlled. Eye movement, destinations, and reprocessing, a treatment method that integrates traumatic memories with patients' own resources, is being increasingly used in treatment of people with dissociative identity disorder. Psychotherapy is mainstream treatment of DID and usually involves helping individuals with DID improve their relationships with others, preventing crises, and to experience feelings they are not comfortable with having. The psychiatrist who had hypnotized him decided that he had 4 additional personalities. Diana, 4 years old, sought security and attention and had temper tantrums. Gail, age 12, had a personality similar to the patient's as a teenager. Mitch, age 26, appeared as an auditory hallucination, disturbing his sleep, which reactivated his memories of sexual abuse. The Deathman, age 27, intervened when Mitch, Gail, and Diana argued. The patient would become suicidal after receiving orders to die from Deathman or from Mitch. However, when Gail and Diana would then provide sufficient support to allow him to get help, either from the police or psychiatric services.
When we have a patient that is diagnosed with multiple personality disorder, we see that the patient is primarily affected in the limbic system. The limbic system is a portion of the brain that deals with 3 functions: emotions, memories, and arousal. This system is composed of several parts which are found above the brainstem and within the cerebrum. The limbic system connects parts of the brain that deal with high and low functions. When we talk about the major parts of the limbic system, we have to look at the 3 major parts, which include the hypothalamus, the thalamus, and the cerebrum. The thalamus is a portion of the brain that is responsible for detecting and relaying information from our senses such as smell and vision. The thalamus is located within the brainstem and is part of the pathway of formation into the cerebrum. The cerebrum is part of the section of the brain that is responsible for thinking and movement. Lastly, we have the hypothalamus. It is a vital portion of the limbic system that is responsible for producing multiple chemical messengers called hormones. These hormones control water levels in the body, sleep cycles, body temperature, and food intake. The hypothalamus is located beneath the thalamus. So when we look at multiple personality disorder, we see that there's a clear
about me, but I know about you. So say hello to falsetto in 3, 2. I'd like to be everything you want. Hey girl, let me talk to you. I was old enough to be your boyfriend. I never let you go. I keep you on my own, girl. You'll never be alone. Like to be a gentleman.
Also, the pharmacists. They're responsible for filling the prescriptions for the patients. A doctorate degree from a program accredited by the Accreditation Council for Pharmacy Education is required. After being prescribed neuroleptics, John proceeded to question the pharmacists about the medication. His psychotic symptoms improved with neuroleptics. The patient, however, refused to even consider the diagnosis of schizophrenia, stating that he preferred the diagnosis of MPD since it was treatable. Learning that you have dissociative identity disorder is shocking and terrifying. On top of that, learning that you have amnesia about different parts of your life. You also have to deal with learning about why you are this way, and the reason always involves ongoing severe trauma that began when you were a young child. That is a lot to take in, and some handle the news with more grace than others. Even those who handle the news with grace are shaken to the core. The biggest difference between those who handle the diagnosis well and those who do not is willingness to believe yourself. The more you fight the truth, the more difficult the journey is. And after plenty of observation, psychologists can attest that John is handling it tremendously.
Dissociative identity disorder has always been considered to be quite rare, but it may be more common than previously thought, and some estimate it to affect 1% of the population. This higher estimated prevalence may be due to millions of people now reported incidences of childhood abuse. Pathological dissociative states are less known in some parts of the world like China. However, in the United States they are highly prevalent. Dissociation is more common in psychiatric patients than in the general population, and even more common among those that have suffered childhood trauma. When we look at other facts about those who get dissociative identity disorder, we see that dissociation is present in all races but is more common in American children. Females experience more childhood abuse than males at a ratio of 10 to 1, and thus more females suffer from dissociative identity disorder. However, more males who have been abused may experience pathological dissociation later in life. Dissociative identity disorder is typically caused by the trauma occurring at less than 9 years of age. Early age of abuse onset predicts a greater degree of dissociation. The average number of alternate personalities of a person with DID is between 8 and 13, but there have been cases of reported of more than 100 personalities within one individual. One last statistic is about how dissociative identity disorder is one of the most common disorders, where it is seen that 17.2% of a large inpatient group are those that seek treatment suffer from substance abuse. Some psychologists and psychiatrists believe that instances of demon possession recorded over the centuries may have really been MPD, but the first complete account of a patient with multiple personality disorder was written in 1865. More than 4 years later, French neurologist Pierre Janet discovered that a system of ideas split off from the main personality when he hypnotized his female patients. Soon afterward, William James, the father of American psychology, uncovered a similar phenomenon and termed the condition dissociation. In 1886, American author Robert Louis Stevenson popularized the disorder in his novel The Strange Case of Dr. Jekyll and Mr. Hyde. Although this work of fiction captured popular imagination, the concept of multiple personalities was rejected by Sigmund Freud and later by the behaviorists. The mental health community believed the disorder was extremely rare, if it existed at all. Despite well-known movies such as The Three Faces of Evil and Sybil, which recounted the life stories of women with MPD, by the beginning of the last decade, only about 200 cases have been documented in world psychiatric literature. Finally, in 1980, the American Psychiatric Association officially recognized multiple personality disorder as a genuine emotional illness. Today, MPD is a relatively popular diagnosis ranging from 20,000 cases to 30,000 cases being recorded between 1980 and 1990.